This podcast is brought to you by The Senior Techie, a source of information for seniors and others about technology. You know, when we talk about managing health, especially if you're juggling maybe 3, 4, or even more medications, it gets really complicated.
It does.
We're talking about those stacks of paper slips, the constant runaround trying to call in refills, just that underlying worry. Wondering if your doctor and your pharmacist are really on the same page.
And that lack of coordination, that's exactly what makes this topic so critical. The senior techie points to this as a serious everyday problem.
Right.
When that communication breaks down, it can lead directly to medication errors, missed doses, things that can escalate quickly. We're talking poor health outcomes, even hospitalizations. These new simple digital tools, they're really the most direct solution to those risks.
So our mission today is to really dive into how these digital tools are changing medication management. We want to focus on the key insights around safety and convenience for you and move you past the frustration of phone calls and that awful handwriting to get you into a safer, more automated system. We want you to feel empowered by this, not overwhelmed. Okay, let's unpack this. So when we talk about this whole digital shift, I think we have to start with the true backbone of it all. The electronic prescription, the e-prescription.
Absolutely.
Most of us get the basic idea. It's a digital order, goes straight from the doctor's office to the pharmacy, instantly eliminates those paper slips. Now, that's a huge jump in convenience, but I think the real life-saving benefit is that safety net it provides.
You're absolutely right to focus on safety. The convenience is great, no more jammed fax machines. But the crucial thing, and it's often invisible, is what happens before the order even gets to the pharmacist.
Okay.
When a physician enters that e-prescription, the system is designed to automatically check it against your patient record. It's looking for known allergies, for drug interactions, even potential dosing errors, all in real time.
Wait, so this check happens automatically before a human pharmacist even lays eyes on it. It's not just a delivery system.
Precisely. Think of it like an instant automated security firewall. It's working in the milliseconds after the doctor clicks send. And the data on how well it works is... well, it's really compelling.
I'm curious to hear this.
The senior techie reviewed a study of 3.3 million prescriptions. And for a massive 33% of them, that's 1 in every 3 doctors, got an immediate alert from the system about a severe or moderate drug interaction.
33%? That is a shocking number. It suggests that a third of the time, the original prescription had a potential flaw.
Exactly. It could be anything from mild side effects to something genuinely dangerous. And here's where the system proves its worth. That immediate feedback led to crucial changes in 41% of those flagged prescriptions.
Wow.
So if you translate that, what it means for you, our listener, is that more than 400,000 potentially dangerous prescriptions were caught and corrected before a patient ever even picked up the bottle.
That's profound. We aren't just talking about avoiding a mild headache. We are talking about preventing actual trips to the emergency room, or worse, all because a digital tool stepped in.
Absolutely. Now, the pharmacist's oversight is still essential, of course, but this automated check creates a critical, invisible layer of protection right at the start.
Right at the source.
The data from the senior techie shows these systems cut down overall medication errors by anywhere from 13 to 99%, depending on the setting. But it achieves a confirmed risk reduction of about 15% compared to old-fashioned paper prescriptions. What's fascinating here is the safety is now just embedded in the process. It's a foundational piece that ensures the pharmacist gets the right order instantly, and it provides that first shield against human error.
That really sets up the next step perfectly. So once that safely checked prescription arrives at the pharmacy, the next digital revolution is probably already in your pocket. I'm talking about the pharmacy app. We've all seen these apps from CVS, Walgreens. They've evolved so much. They're not just for requesting a refill anymore. They've really become these comprehensive health managers.
And they solve those immediate pain points, the daily routine. For years, refills meant either driving to the store or just sitting on hold, listening to that awful music, waiting for a pharmacist.
Oh, the frustration of the refill line. I think we all know that feeling.
We do. And now, the ease of use is it's the main appeal. You can request a refill with a few taps. You can scan the barcode on the bottle, which guarantees accuracy, or just pick it from your history list.
No waiting, no busy signal.
None. And it goes beyond just simple refills, right? For anyone managing a chronic condition, adherence, making sure you take the medication on schedule, that is absolutely critical.
Of course.
And that's where the safety part of the app really shines. They store your entire prescription history, but more importantly, they have these proactive tools built in. They'll send you a notification when it's time to reorder so you avoid that last-minute panic when you realize you've only got one pill left.
Uh-huh.
But the truly essential feature, I think, for adherence is the pill reminder tool. You can set specific alerts for your own regimen by time, by medication, by frequency. It just replaces all the post-it notes and kitchen timers with a dependable digital reminder.
And the convenience just keeps getting better. Same-day delivery is pretty standard now, which is a huge help for anyone with mobility challenges. And things like contact-free curbside pickup, they're seamless. You just show a barcode on your phone.
The senior techie also highlighted an advanced feature in the CVS app that offers automatic refills for your regular medications.
Boom.
And it has built-in alerts for things like insurance issues or if a doctor needs to reauthorize the script. It connects the clinical side to the logistics side automatically.
That connection is so important. It's about more than just the pills themselves.
Exactly. These apps are becoming central hubs. They often link to your broader health records so you can see your prescription history, your test results, even your immunization records, all in one place. The CVS app even lets you schedule MinuteClinic appointments directly. They're becoming full-service health concierges.
Okay, let's shift focus to a major challenge, one that really impacts our audience. Polypharmacy.
Right.
That's the clinical term for taking multiple medications at the same time. And when you're dealing with 3, 5, even 10 different pills, the risk of dangerous interactions just skyrockets.
And that's where these specialized interaction checkers become, well, non-negotiable. And it's really important to understand the difference between the professional tools and the consumer apps you might have on your phone. So pharmacists and doctors, they rely on professional systems like Lexi Interact or Epocrates. These are incredibly sophisticated. They have very high accuracy. We're talking sensitivity rates between 77 and 87%. They flag drug reactions, sure, but they also check for dosage adjustments based on your age, your kidney function, or conflicts with other health conditions you might have.
So if those professional tools are so accurate, how do the consumer apps like MediSafe or MyTherapy compare?
The consumer apps are fantastic for convenience. They have great reminders, they offer interaction checking, some even use AI. But the senior techie notes, their accuracy can vary. A lot.
Why is that?
It often goes down to data access. A consumer app might not have your full verified medical history or your latest lab results, which are vital for those really complex checks.
That makes sense. So the takeaway for you isn't to rely only on the phone app for checking interactions, but to use it for reminders and management, knowing that the pharmacy has that professional-grade safety net running in the background.
Precisely. The best approach is combining the convenience of the app-based reminders with that essential, highly accurate oversight from the pharmacy. You really need both layers working together.
That focus on accuracy and personal control brings us to another powerful tool, patient portals. These are the online systems from your doctor's office or hospital that put your medical information test results, medication lists, right at your fingertips. And I think a lot of people just assume a portal is for looking at test results, but it's so much more dynamic than that.
It's all about empowerment and accuracy. For one, secure messaging in the portal just eliminates that awful phone tag for simple questions or refill requests.
It's a huge time saver.
It is. But the biggest benefit is the ability for you, the person who knows your health best, to review your own records and catch errors. You can spot things like a medication you stopped taking months ago that's still on your active list, or maybe an incorrect dosage.
Here's where it gets really interesting. Because of these portals, you become the final quality control check for your own care. No one is in a better position than you to see those little mistakes. If a dose is wrong or a medicine is still listed that you haven't taken in a year, you can send a secure message right then and there and get it corrected. That just wasn't possible with paper charts.
It's transformative. You're moving from being a passive recipient of care to an active manager of your own health data. And that is so crucial for safety.
Okay, finally, let's talk about a real game changer for accessibility. Telepharmacy. Now, this might sound a little technical, maybe expensive. Can you break that down for us?
Telepharmacy is much simpler than it sounds. It's basically just consulting with a licensed pharmacist over a video call, the phone, or through secure messaging. Think of it as a virtual, dedicated appointment with your medication expert without having to leave your home.
So no traffic, no parking.
None of it. And the services they offer are extensive. You can discuss a new prescription, go over side effects, or have the pharmacist review your entire medication regimen, all your prescriptions, over-the-counter drugs, vitamins, everything.
And for anyone managing a chronic condition like diabetes or heart disease, that kind of personalized, accessible advice seems vital. It removes so much of the strain of travel. But is it covered? Is it a big out-of-pocket expense?
And that's the best news, something the senior techie really highlighted. Coverage has improved dramatically. Medicare Part D now covers telepharmacy services through major networks like CVS and Walgreens.
Oh, that's fantastic.
It is, and it's already showing clear results. The data suggests that for patients with chronic diseases who use these services, medication adherence improves by about 25%. When you have an expert you can easily talk to, you stick to the plan better.
So if we step back and look at the whole picture, the real power here is how all these digital tools connect.
Absolutely. The system is layered. The doctor's e-prescription hits the pharmacist's super accurate checker. You get a notification on your pharmacy app when it's ready. The app reminds you when to take it. And if you have questions, you can schedule a covered telepharmacy call to review everything, and all those notes go right back into your patient portal. It closes all the old gaps in the paper system.
So what does this all mean? It means safer, simpler medication management and much better coordination across your whole healthcare team. So let's turn this into action. Here are 3 easy steps you can take today. First, start simple. If you use a major pharmacy, download their app. For your next refill, don't call. Just try doing it through the app. See how easy it is.
Second, ask your doctor's office about registering for their patient portal. You usually have to ask for access. Once you're in, just start by looking at your medication list. Make sure everything on there is accurate.
And finally, if you do take multiple medications or you have questions about side effects, ask your pharmacist about those covered telepharmacy consultations. They are designed to give you quality time with an expert to help you regain control.
And although these tools might require a little bit of learning up front, the knowledge you gain, knowing your history is correct, catching errors yourself, getting those instant safety checks, it gives you a level of control over your health that paper systems never could. Just think how much faster decisions can be made when a simple portal message replaces days of phone tag.
This podcast was brought to you by The Senior Techie. It's available on Apple Podcasts, YouTube, and Spotify. If you'd like to keep up with their newsletters, you can subscribe for free by going to theseniortechie.com.